Good afternoon. I am Suzanne Lawson with Constellation Consulting, and we are pleased to present the New Mexico 2021 Summit on Health Equity. The summit is funded by the New Mexico Department of Health Tobacco Use Prevention and Control Program and will take place throughout May on our event app with live sessions each Wednesday afternoon. For more information about the summit, please visit our website at nmhealthequity.org. Due to COVID-19, this year's Summit on Health Equity remains an online event. We appreciate those who have participated and supported this year's event, including the New Mexico Department of Health, our summit planning team, Presbyterian Healthcare Services, Cornell Health Foundation, BeWell NM, the Santa Fe Community Foundation, and others. For a full list of our supporters and online exhibitors, please visit our event dashboard online or on the Whova app. I also encourage you all to utilize this year's Summit on Health Equity event app. The Whova app provides you all with opportunities to network online, schedule COVID-safe meetups, create discussion groups, visit our exhibitors and supporters, watch recordings of sessions you may have missed, download files provided by our presenters, and more. It is a great tool for you to use not only during our live sessions, but also throughout the month. Plus, when you use the app, you can earn points, which could mean prizes. Please check the leaderboard in Whova for more information. For today's session, attendees' webcams and microphones have been disabled. If you have a question for today's presenter, please use the Q&A function within Whova, and we will address as many questions as time allows during the Q&A. Also, any materials provided by today's presenter will be posted as part of this session within the event app. If you need assistance during this session, please utilize the Q&A feature or Ask the Organizer feature in Whova. You may also try emailing us directly at info@constellationnm.com. Following today's session, we appreciate if you take a few moments to complete our session feedback by clicking Rate in this session of the Whova app. If you would like to request community health worker or social worker CEUs or continuing medical education units, please include your name and email address on your evaluation, and CEU certificates will be emailed out within 60 days. If you need assistance with CEUs, please email us at info@constellationnm.com. Finally, before we begin today, Constellation Consulting acknowledges that our organization operates primarily on the unceded ancestral homelands of the Tiwa-speaking peoples. Racism has no place in our communities. Constellation Consulting and our team members are committed to racial equity. We acknowledge and denounce the violence and discrimination affecting the Black and Asian and Pacific Islander communities with whom we stand in solidarity. We are New Mexico, and we were built strong by the diverse people of our communities. There are a variety of organizations supporting health equity throughout our state. We have listed just a few here, if you'll go ahead and advance the slide, and encourage each of you to seek out, learn more, become involved with, and support organizations who are building a better New Mexico for us all. Today, we are excited to host Ray Tafoya, who is a proud tribal member from the Kiowa Pueblo, Santo Domingo. Most of his career has been as an advocate for tribal sovereignty and Native American rights. He has been involved with tribal planning, program design, as well as contract and budget negotiations with Indian Health Services, Health and Human Services, and other state and federal agencies. He currently serves as treasurer for the board of directors for the Kiowa Pueblo Health Corporation, a tribal 638 health facility in central New Mexico. He currently works as a strategy consultant, helping tribes build capacity to meet the needs of their residents and communities. You can read all of our presenters' complete bios in our event app and on our website at nmhealthequity.org. Please welcome Ray Tafoya.
Thank you, Susan. Good afternoon, everyone. And I want to thank everyone for joining me today. I appreciate everybody's attendance. Today, we'll be talking a little bit, actually, let me back up a little bit and do a proper introduction. Again, as Susan said, my name is Ray Tafoya. I'm from the Santo Domingo Pueblo. Again, with all the respects and to everyone attending, thank you very much for allowing me to speak. Again, I'm Ray Tafoya, come from the Santo Domingo Pueblo. I currently serve as the treasurer for the Kio Pueblo Health Corporation. As Susan said, we do run as a tribally operated 638 health facility, primary care. I'll talk a little bit about that in a little bit. But also wanted to talk a little bit about my background. As I said, I work with tribal communities in increasing capacity and increasing access to different services, including healthcare. And so certainly a proud member of the Santo Domingo tribe, and I wanted to thank everybody for attending today. So we'll go ahead and get started here. Today we'll be talking about overcoming technical challenges in rural tribal communities. And to really put that in context, I'm going to be using Santo Domingo Pueblo as a case study, if you will. Santo Domingo is a rural community. And so one of the things that we've faced challenges with is definitely having access to different services. So we'll talk a little bit about Kio Pueblo, background and demographics of the Pueblo and where we come from and where we are. Talk a little bit about Kio Pueblo Health Corporation and our endeavors that we've taken on to provide healthcare, quality healthcare to our community members. We'll talk a little bit about challenges that we faced in technology. And I think really when we talk about technology, I think we all know the underlying story is access to internet. And so we'll talk about the challenges to that. We'll talk about some solutions. We'll talk about some different ways that we've gone about addressing these challenges and different ways that we've gone about overcoming the different issues that we've had to face being in a rural community. I think we can all agree that in addition to Kio Pueblo and most of the tribal communities, there are a lot of, most of New Mexico is a rural community. And so I'm sure that today's session can probably fit across the board in a lot of New Mexico communities. So I hope that some of the ideas and solutions that we bring to the table and some of the thoughts that we bring to the table today will help you in your endeavors helping your own communities. And then we'll have a Q&A session, that we can spur some good conversation on this topic. Okay, so let's get started. Kio Pueblo. Right there is a picture of my homeland, as where I come from. As you can see, a lot of older homes. Really, honestly, the community itself sits on a site that is hundreds of years old. Kio Pueblo, we've been in existence since the 1500s or even further back. There are records of the Pueblo peoples in the area, but Kio Pueblo in its current state has existed since the 1500s. A lot of agricultural areas. We're a very traditional tribal community. That's one of the hallmarks of Kio Pueblo, is that we are a very traditional community. We hold a lot of our cultures very dear. Our language is very important to us. And we're very conservative. Don't have a casino. We're a non-gaming tribe. And we do have a few limited economic development ventures, but for the most part, very traditional. Approximately 5,000 residents in the main Pueblo area. We do have residents that live off reservation. But again, housing is another issue that we face. Talking about a rural community. And the reason I bring these up is because there are challenges in all shapes and forms. When I was thinking about doing this presentation and I was going through the ideas and where I could take it, quite honestly, it took me in a ton of different directions because there are multiple challenges being faced in any rural community. And so in this context for a conversation today, we'll be talking about it in the context of healthcare. And so if you think about Santo Domingo and Kio Pueblo, we're 30 miles away from the nearest hospital facility. And so that was really the impetus for why the tribe wanted to build and develop its own healthcare facility. We've depended since the mid 1900s, we've depended on Indian Health Service to provide our services. And as was the case, we had a small clinic down in the Pueblo, which was staffed by one doctor and one nurse, maybe 3 days a week. So it was very limited. I believe at its peak, could see 6 residents in a day. And so really 6 appointments in a day. And in a population of 5,000, that just wasn't going to cut it. And so we really had to look at different ways of expanding that. And we were able to build this facility here. Going on, most of our residents have to commute to work or school because we don't have a lot of employment nearby. Our nearest high school is Bernalillo High School or the Santa Fe Indian School, which again, either way is about 25 miles. Mainly agricultural areas, so we are a very rural area. But it's ironic, as rural as we say we are, in my experience, what we've been able to find is that a lot of grants through a lot of agencies do not allow for a rural designation for Kiwo Pueblo because we do sit within a 50-mile radius of certain urban areas, is what their technical definition. So we've had to go back and we've had to lobby for different special exemptions on those. And I'm sure that a lot of rural communities here in New Mexico face the same challenges. So that's a little bit about Kiwo Pueblo and where I come from. And so looking at some of the challenges that we've had, what are some of the challenges that we've had? We've had limited opportunities in the following areas, areas of healthcare. Like I said, Indian Health Service was there to provide services until the tribe took it under its own wing. Education, we do have one K-8 primary school here on the reservation, but it is a public school run through Bernalillo Public Schools. But again, it's not a tribal run school, so we don't have say-so over the education. And to go to high school, again, it's either Bernalillo High School or Santa Fe Indian School. Business and economy. The primary source of income of a lot of our tribal members, a good majority of our tribal residents is jewelry making. Silver and turquoise making is really the big economy here within the Pueblo, if it's not agriculture. So really those are the two big economic drivers within the community. A lot of people do go off reservation to work in other jobs, but the majority stay home and do their crafts. Basic information flow. One challenge that we faced, especially now during the pandemic, was getting information out, emergency information and news. So having that access to information. When COVID hit and there was a pandemic going on, we definitely had public health orders that went out, and information flow was difficult at best to try to get out to the community. So definitely that was a big challenge, was the communication issue. And then entertainment. Let's all admit it. Me and my son sat and waited to watch the new Kong versus Godzilla movie when it came out. So I think that was definitely one thing that we also want to take advantage of if we can. And again, in the context of what we're talking about, technical challenges, I think the real groundwork and the infrastructure that really takes precedence here is access to the internet. How do we get access to different sources of information, and how do we take advantage of those? So how were residents of Kiwo Pueblo accessing the internet? How are they accessing that information? First and foremost was dial-up. As we can all agree, dial-up is very slow. Downloads were not happening. It was taking forever to download a simple document or to even upload information. And then security was an issue. There definitely were not firewalls in place. There definitely was not the security that is in place now. And so that was the first way that our tribal residents were accessing the internet. We've had satellite providers come in and provide internet access. Again, it's expensive. It's a very expensive mode of accessing the internet. And as I alluded to before, a lot of our tribal residents don't have full-time work. They depend on selling jewelry and crafts, which at times isn't a very stable source of income. Again, going back to the demographics, the majority of the children that go to our local school qualify for free lunches and Medicare. And so there's a lot of low-income families out there. So turning to this as an option, it really wasn't an option because it was very expensive. Recently, we've had a huge influx of people using mobile phones and hotspots, using their mobile phone as a hotspot. Again, cost is an issue. It's very expensive to have those data plans, but also the area that we're in, cell service isn't very good, and so service can be spotty at best. There's also limited service. There's limits on data. So again, that's not a feasible access point. There have been other methodologies, T1 lines being one, but those were brought into the tribal government and to business, and so weren't readily accessible to the general community. So definitely those have been challenges that we faced in accessing the internet. So again, in context of what we're talking about here, access to healthcare, how is access to information flow and to the internet and to technology. How is that affecting healthcare? And so we'll talk a little bit about here myself. I represent the Kiwa Pueblo Health Center and talk a little bit about the advances that we've had in healthcare, but also trying to bring it full circle back to how do we provide that technological capability to enhance healthcare within the community. So a little bit about Kiwa Pueblo Health Center, our primary healthcare facility. Right now, our primary service area is the Kiwa Pueblo, Cochiti Pueblo, and San Felipe Pueblo. We also serve other Native American residents that live in the area. We've actually got people that choose not to go to the IHS facility in their communities and come to see us, which is good. And so they're certainly proud of that. Services that we provide, primary care, dental, vision, behavioral health. We also have specialty clinics. And so we've also had a recent expansion that allowed us for new services and capabilities or capacities. And then we're looking at expanding services to surrounding non-native communities. Again, trying to be that good neighbor within the rural communities. We know here in Santo Domingo, we also have sister communities of Peña Blanca, Sile, Buttergers, Algodones, and Cochiti Lake. And so we're looking to be able to service those residents as well. So the biggest challenge that we faced here in Santo Domingo or in Kiwa Pueblo is just number one, first and foremost, geography. Is just our location. So what you can see up on your screen right now is just a quick snapshot of the general area where Santo Domingo or Kiwa Pueblo is located. So you can see right around here, these little areas, that's where the main Pueblo is. The green spots are all of the agricultural areas. So you can see how much farmland is there. Our proximity to the Rio Grande. So we're down in the valley. These little hills here create an issue with line of sight. And so it's been difficult to try to get cell service. It's been difficult to try to get even basic technology infrastructure. So phone lines, and even right now what we're working on is a fiber optic line has been a challenge just due to the geography. Down on the lower left or lower right here, that is where our health facility currently sits. We've got a campus with the K-8 school. We've got a early childhood development center with Head Start. Our health facility and our gas station is there, as well as our emergency medical and fire station is also located there. But the challenge is these are located approximately 5 miles away from the main community and the main residents. So how do we make that connection between the two? We'll talk a little bit about that in a little bit, but that just kind of sets the precursor for some of the geographical challenges that we've had to face. So when it comes to healthcare, what were some of the challenges that we were facing when it came to technology? As everybody knows, with the pandemic going on, there was a big push from government agencies, government health agencies, Health and Human Services, Indian Health Service, even Centers for Medicaid, every organization that was dealing with health was pushing the telehealth option. When people couldn't leave their homes, people couldn't go anywhere, but still needed services. And they said, oh, here's the latest, greatest, here's the best solution for it is telehealth, which is great if you have access to it. And so, again, that was the challenge that we faced. Would we still have the ability to provide services during the pandemic? One other challenge that we faced as far as telehealth goes, or the telehealth option goes, was transportation. Here at the health facility with Kiwa Pueblo, we provide transportation for 60% of our clients. So 60% of our appointments that are set and that are seen here at the clinic, we provide the transportation. We bring them to and from their homes. So that should tell you that there is definitely a shortage of transportation. And it's not only in the healthcare fields, it's for education, it's for work, it's for all these other services, and access to other services that transportation has been a challenge. Challenges in access to care, online health records, trying to get people to get their information. And how do we get their information in a timely manner where it can be most useful for them? One of our pushes here at the clinic is to really work on preventative care. And if people don't have access to their health records, if they don't know what state they're in right now, how can we expect them to take care of their preventative health? So it's really been a fine line that we've been trying to balance on access to information. We've recently implemented a new database and an electronic health record, which is going to allow us to do pharmacy refills and appointment scheduling on an app basis. But again, the challenge is, how do we get those clients to access those services? So we can certainly put those out there, but if we don't have people with the capacity to be able to access those services, that presents a challenge. Some of our support services that we've put in, I talked earlier about our expansion and our addition of capacity. We've recently added imaging, X-ray and CT scans. But the analysis of those and those going back and forth to, we currently have a contract with X-Ray Associates of New Mexico. So to send that information, which is very complex, a lot of those files are very big. So having the capacity to be able to send those to X-Ray Associates and have them do the analysis for us and send them back. You can imagine trying to do that with dial-up. It would take days for that download to go through. And so definitely having that access to adequate internet speeds is definitely was a big challenge. Lab work, same thing, trying to get that information over to Tricor and our other lab partners, especially now with the pandemic, trying to send information to labs to get a timely response. When we were doing COVID testing, time was of the essence. It did not do us any good to get testing back, 4 to 5 days later. We had to get the information as quickly as possible so that way we could ensure the safety of our community. So you can see how a lot of challenges arise when it comes to healthcare. There are definitely a lot of solutions, and I think in a lot of instances we take for granted that those solutions are easy to come by. But if you don't have the right infrastructure in place, they can be a difficult challenge. So what did we do in Santo Domingo? What were some of the things that we worked on? We worked on a broadband project to bring a fiber optic line to Santo Domingo. It was a multi-tribal consortium consisting of Kiowa Pueblo, Cochiti, Santa Ana, and San Felipe Pueblos. And again, having to be innovative, talking about solutions. I apologize, I'm going to be jumping around on this just because it goes off on different topics and there are different ways. I don't think you can follow one timeline on this. So, again, getting together, one of the solutions that we came across, and I'll talk about it a little bit later, but it was collaboration within communities. It was working together. It was getting people to come together and realize that there was a need for the region and for our people. And so that's what brought these communities together. And we were able to work with the FCC. And it's the FCC E-Rate Schools and Libraries grant that was able to fund a majority of this initial project that was able to bring broadband up the Rio Grande Valley. Started in Albuquerque and came all the way to Cochiti Pueblos, where we were able to connect or lay the basic infrastructure. It was connecting the schools and connecting our tribal libraries, but with some additional funding that was secured through the state and through the tribes themselves. We were able to connect other entities, and now we're able to put that out to the communities as a whole. So I talked about it being a multi-tribal consortium. Kiowa, San Felipe, Santa Ana. I'm sorry, I missed Cochiti. I double typed San Felipe. Sorry about that. But Cochiti Pueblo was in there. So you can see there's the group that got it done. We had Pueblo governors there. We've got tribal representatives, and we really felt it was important that the kids get involved in it, and that the students understand what we're trying to do. One of the solutions that we'll talk about a little bit later is getting buy-in from the community, and so getting the children to understand that this is access to information is beneficial for them in the school. So challenges, every level we face challenges, and really the challenges come to light, and it's how do you deal with them. So earlier I talked about one of the challenges just being geography. Along with geography came, we had a right-of-way issue. Cutting across the Rio Grande Valley, as you can see by the map here, we had to go across Santa Ana reservation lands. We cut through San Felipe tribal lands. There's a little bit of state Bureau of Land Management operated land. There is also the Santo Domingo Pueblo reservation that we had to go through, non-native communities of Sile, Peña Blanca, all the way on up to Cochiti, and we had to cross Cochiti lands. And so getting the partnership, getting the agreement of all those involved was key. It was key in overcoming and seeing this project to fruition. So again, going back to the geographical challenges. So you look at just laying the line itself. I showed this slide earlier, but if you can see, again, just the geography of trying to get the fiber network in place was a challenge. Coming up the Rio Grande Valley and then having to pull from that main line, which is the purple line on your screen. That's the main fiber line that was laid in the initial groundwork. We had to spur off of that to come up to the clinic and come up to our school as well. And so that in itself posed a different challenge because, again, the geography of the land, the makeup of the different materials and being able to lay that fiber, it took some work. And so we were able to get that going, which again, so that was step one, was getting the fiber network laid. And so once we got that laid down, that was the first challenges. And again, it comes with its own issues that we've got to deal with. This is one that is an unfortunate reality, is funding. How do you pay for a project like of this size? I think all told, this broadband project was somewhere in the order of close to $8 million. How do you share that cost? How do you get that agreement? How do you get all the parties to effectively portion out the cost of that project? Excuse me. Next challenge was access to bandwidth. Even though fiber is great and there is a ton of information flow that can happen on that fiber network, it is limited and there is capacity on that. And so how do you share that? How do you work with that? And then how do you get the community how do you get access out to the community? So it's one thing to lay the fiber network. You've got to have a spur that goes out into the community. And so how does each community deal with that? And how do we get it into the homes? And then talking about the effects with healthcare, how do we get the end user to really access that technology to be able to increase their level of sophistication and accountability within their own healthcare? How do they take control of their own healthcare and use this technology to better themselves? One of the again, challenges that we faced at different levels. In number one, in getting the fiber network in place, there were challenges of governmental issues, funding issues. Once we got the fiber network laid, there were challenges of access in the homes and distribution. And then once we got that solved, you get down into the homes to the micro level. You talk about the end user. Do they even have a computer? Do they have a way of accessing that new flow of information that we're giving them? What are the different ways that they can access it? And are they computer savvy enough to be able to access that? Again, all challenges that we had to face and things that we had to deal with. So we've talked a lot about challenges. We've talked a lot about what were the things that we faced in trying to get these together. Now I want to talk a little bit about the solutions. Again, working from the top down, what were some of the big challenges that we faced in the beginning? On the governance side, we really had to get trust and accountability of all the parties involved. We had multiple meetings with tribal governors. We had multiple meetings with the state. We had multiple meetings with other government agencies. And so that way everybody was on the same page of what we were getting into and what the benefit was going to be. So really that trust was a big portion of it, to get everybody to understand that this is a good thing. This is going to be a good thing. It's going to be a good project. It's going to bring benefits to each one of their communities. Second was planning. I've heard people say that a good plan poorly executed isn't a good plan at all. So again, that's where the trust comes into play. We did a lot of planning. We looked at a lot of previous history, looked at all the information available at the time, and we got experts in to look at what were the different solutions. So we were able to anticipate a lot of the challenges that we were going to face and be prepared for them when they did hit. So it wasn't really a surprise when it did hit. But again, just making sure that the collaboration, making sure that the investment is there, making sure that all the parties know that this is a benefit for them and that they do have an invested interest in it. Again, goes back to trust and making sure that that's there. Education was also a big key in gaining that trust. Education at all different levels. Talking to some of the tribal governors and the tribal councils and getting them to understand what was going on and what the logistics were. Down to, I talked about the end users and the people in the homes. Even to this day, we're still doing basic computer classes, and we're doing basic information sessions with tribal residents to get them to understand how to use a computer, how to access the internet. What is this new power that they've been given? And so that's been a big thing within our community. And then the question that we always have, is there an end goal? We talk about solutions, and there's always going to be a need. Our communities are always changing. Needs are ever evolving. Technology is always advancing. So things are always changing, and it's not, it's very difficult to keep up, especially when it comes to technology. It's very difficult to keep up with the trends. It's difficult to keep up with the new technology that's out there. How do we keep people informed, and how do we keep people working towards the goal? And I think the goal is just really a more informed community and providing for a better state of health within those communities. And so how do we get there? It takes a lot of collaboration when we work, even to this day, when it's not on technology, just healthcare in general. What are our partners? Who are the partners that we bring into play, and who do we call upon for different expertise? Here within a health facility on the reservation, our partners are the Indian Health Service. Our partners are the State Department of Health. Our partners are Health and Human Services and all of their agencies. Neighboring tribes. People like yourselves, people that attend and want to learn and want to help. These are the people that we call upon for assistance, and vice versa. And so it's really just become a good neighbor portion of what do we want to have here and what are we trying to do. So in the big picture of things, it's really just that collaboration. That collaboration and trust has really been, in my experience, has been the biggest key of a successful project, and successfully overcoming a lot of these challenges is really just getting that collaboration, getting the buy-in from all the groups involved, and making sure that we've got the trust of all those people involved. So just making sure that, again, we keep our eye on the ball and we know where we're going. Again, looking at strategy, looking at your community, looking at your specific needs, and what are the goals of your particular community or your organization. Where are we going to grow? Where are we going? Who are our clients? Who are we serving? And what are some of the things that we want to be able to provide for them in the future? One of the things that we look at Santo Domingo especially is the growth of our population. We definitely have to plan for a larger population right now, because we're not going to be at 5,000 forever. We're continually growing. And how are we going to expand to meet the needs of those future populations? Even drilling down to what are the age demographics? We have an aging population. How are we going to service that population? We've got a younger population that is coming up. What are we going to do to service that demographic? So really looking ahead and understanding where you're going with your community and where your community is headed is one of the things that I'm most proud of, being from Santo Domingo and being a tribal member here, is that we still hold on to our cultural values. We still hold on to our traditions. We still practice a lot of our cultures, our celebrations and our dances, while at the same time being progressive and being strategic in where we're going, understanding that growth is going to happen and that we are going to have a different population in the next few years. So again, when I was coming up with this workshop and coming up with the information that I was presenting, I really wrestled with where we can take it, because this, talking about challenges and talking about solutions, it can take you in a million different ways. And it really depends on who you're talking to and who your audience is. You know, I may go in and talk to a tribal council, and they have one set of goals, and that presents its own set of challenges. But if you get out in the community and you have a community meeting and talk to residents and find out what their needs and their wants are, it could be something totally different. So how do we marry those together, and how do we plan, and how do we, as civic leaders, how do we bring those together and provide the best services for our communities? How do we provide that collaboration, and how do we bring those skill sets to our communities to be able to provide those solutions? And so as we move on here, that's actually the end of my slideshow. I will turn it back over to Suzanne for Q&A, and really, again, in this whole Zoom world, yeah, we all have to get used to it. I'm a little more used to having an interactive conversation with my with the presentation and having people ask questions. So we'll roll into that, and I think that will spur a good conversation here. So Suzanne?
Sounds good. Thanks so much, Ray. As a reminder, if you have any questions for Ray today, please submit your questions through the session Q&A tab in Whova, and we will address as many questions as we can during the time allotted. So we did have a question and a couple of comments that had come in through Whova already. So I'm going to read kind of the chain here, and then I'll let you speak to them. So the question was actually, would free internet for tribal areas help out with technology? And then some of the discussion, which you kind of touched on, but maybe you can talk a little bit more about that, is would the people on the tribal lands have access to computers and tablets? Would they be given them? Would they be given training? And also, it says how to utilize them. I guess training on how to utilize them. So I'll let you talk a little bit about, you know, free internet, as well as maybe talk a little bit more about the classes and giving people technology.
Okay. Yeah, actually, and I don't like to say that we're fortunate enough to be receiving CARES Act, because we all know why we're getting CARES Act money is because of the pandemic and because of the state that we're in with COVID. It's certainly an unfortunate methodology that we're getting dollars and that rural communities can get dollars. But at the same time, it's an opportunity to do some things that we might not be able to do or might not have been able to do in the past. And so, yeah, definitely the CARES Act has allowed for access in the homes. It's allowed the tribe to be able to provide internet access. So we've been able to put modems on each of the homes of the school. Any home that has a school-age child, and that is attending school, is available to get free internet from the tribe for now. The trouble with that is that access does cost. It costs a little bit, and maintenance and upkeep. And so we're wrestling with that now of how we want to continue to provide that. But for now, it is free to tribal members. We are also working on the access to hardware. So getting computers, getting tablets. We're trying to find a way to make that a little bit more feasible so we can get that out to the community members. So hopefully that works. If we can do, again, with the rescue plan coming, that was definitely another windfall that we're going to come across, which is definitely going to help. So that'll help us get hardware out into the communities more. And so that way people will have computers and tablets and whatnot, so, you know, whatever their choice may be. And then the classes, definitely, again, going back to education, you know, that computer is only as powerful as the user that has it in hand. And so that's definitely an outreach activity that we're trying to do within the community. And it's also provided us ways to be innovative and again, rolling culture into it, because what we're looking at is a pilot program between our language program, our Head Start, and our younger children to try to engage our senior center. So that way we can marry the two together. You know, kids these days, they know anything and everything about their computers and tablets. So what we thought of is try to get the younger generation to work with the seniors to try to teach them on how to work their computer, even playing games, basic things like that, to get them comfortable with the computers, to get them comfortable with technology. But at the same time, we're giving our elders the opportunity to pass along language and pass along stories, the culture back to the younger generation. So it's kind of a two-way learning. The younger kids are teaching the elders technology while the elders are going in reverse, teaching them history and teaching them culture. And so that's been an exciting pilot project that we're trying to work on here in Santo Domingo.
That's awesome. I love hearing that. So I don't see any other questions coming in at the moment. I do have one other question kind of for our attendees, and this session is recorded, so it'll be something that that people can go back and watch later as well. What can our attendees and people who do view this later do to support the efforts not only on the Kiowa tribal lands, but as well as with the other tribal entities throughout the state?
I think, again, going back to my point of collaboration and partnership, entities like the All Pueblo Council of Governors, the 8 Northern Pueblo Council, which services the Northern Pueblos, even reaching out to Pueblos directly and seeing what your organizations can do in partnership. Department of Health has been a great partner for the tribes. Even we've got partnerships with UNM, the School of Medicine. So if you want to get involved, and if you want to reach out and touch base with tribal communities, I certainly encourage it. My contact information is on there. I know sometimes it's difficult to try to navigate that world, but I do it all the time. And so if people or if organizations are interested, you can certainly reach out to me, and I can certainly help make a connection. I serve on the All Pueblo Council Governors Health Committee, and so we advise the 19 Pueblos, 20 Pueblos, including Isleta del Sur, advise the 20 Pueblos on health issues and access to resources. And so if there's something that you feel or your organization feels they can do and they can participate in, feel free to reach out to myself or reach out to the All Pueblo Council of Governors, and we can get you connected to the right people.
Fantastic. Actually, I have one more question. Can you talk a little bit about the role of community health representatives and the role that they may play in helping this process as well?
I'm glad you brought that up. That's a big initiative that we have going with Santo Domingo and with Kiowa. Our community health representatives, our vision here is that they are tribal members with the knowledge and the expertise and the trust in the community to be able to go out and advocate on our behalf, in the homes. Again, one of the advocacy roles that we're playing with the state and with the Indian Health Service and HHS is we want to have allow for the federally qualified healthcare center designation, which allows us to do outreach activities. Right now, as it stands, majority of health centers can only bill Medicaid and be reimbursed by Medicaid for services provided within the 4 walls. That's why we call it the 4 walls designation. So anything that happens, any services that are provided outside of those 4 walls, technically are not Medicaid eligible for certain facilities. But if we can get this designation, then those activities that happen, health activities that happen outside of the facility are totally reimbursable through Medicaid. And as I said earlier, a large population of Kiowa Pueblo is Medicaid eligible. And so that's where the CHRs really come into play, is that now we can allow them to go out into the community, provide education services, provide healthy living services, support the public health nurses. We were talking about the pandemic, the push for vaccinations. I'm proud to say that Kiowa Pueblo right now is sitting at 82%, well, 80%, I'm sorry, 80% vaccination rate. So, we've been up there, and that's been through education, that's been through outreach. And so now what we can do is we can allow those community health representatives, again, who are tribal members, they can speak the language, they understand the cultural sensitivity. Now they can go out and they can be advocates and try to raise awareness and provide education in the community. And then we can get reimbursed through Medicaid for it. So they definitely play a critical role. And the role that they play is not necessarily the health and medical knowledge that they bring to the table, but it's that cultural sensitivity. It's the language, which again, in any rural community here in New Mexico, those are critical. You know, a health worker who can speak Spanish and go in the home and speak to people in their own language. You know, myself, I'm fluent in my language because my grandfather, both of my grandfathers actually only spoke our language and Spanish, did not speak English, and so I had to learn it. And it helps, and it helps build that trust, and it helps bring people to the table to understand if you can put things back in their terms. And so that's where the community health representatives come into play, and that's where they're so critical, is that flexibility that you can mold them to the community that they're serving, and they can be more effective.
Fantastic. Thanks so much. Okay, I don't see any other questions that have come in. So thanks so much, Ray, for your time and your expertise today. We really appreciate all of your efforts towards creating true health equity in New Mexico. And thank you to all of our attendees for joining us today and throughout May. A recording of today's session will be posted in the Whova app soon, and recordings from all of our sessions will stay live in Whova through June 30th. On July 1st, all of this year's sessions will be moved and available at nmhealthequity.org. Please remember to check your event dashboard for more information about our final sessions, including today's session coming up at 2 o'clock, Disability, Inclusion, and Accessibility, presented by Jesse Calero. Thanks so much, everyone. Have a great afternoon.